Hi, I'm Dr. Blair Hollowell, an AVMA member and trustee of the Group Health and Life Insurance Trust. Along with insurance products, the Trust is committed to providing veterinarians with education and awareness of issues impacting their health and well-being. That's why I want to talk to you today about compassion fatigue. Veterinarians have been called to a unique and stressful field. In one day, we can find ourselves handling emotions running from the joy of a new pet to that deep sadness that accompanies the diagnosis of terminal illness. We get angry when we see neglect or abuse, and we struggle with internal conflict when clients cannot afford the treatment their pet desperately needs. The result of these emotional swings can be compassion fatigue. It's a deep physical, emotional, and spiritual exhaustion that comes from chronic exposure to situations where compassion is required. Veterinarians are not the only ones who suffer. All healthcare workers, including our staff, are at risk. As practice leaders, we must learn to recognize the signs in ourselves and our team. In my experience, compassion fatigue often manifests as tightness in the chest or a pit in the stomach. You don't think that you can move forward, but you know that you have to. Other symptoms of compassion fatigue include isolation, exhaustion, forgetfulness, loss of interest, frequent illness, anger, loss of sleep, and even drug or alcohol abuse. Some veterinarians can continue to give themselves fully to their patient despite experiencing compassion fatigue. Others find it difficult to maintain a healthy balance of empathy and objectivity and wind up sacrificing personal emotions to continue performing professionally. There is good news, however. Compassion fatigue can be managed and even prevented. The key is to set aside time to recharge your batteries. It's often easier said than done, but it's important that you learn how to leave the white coat at your hospital and take time away from your practice to clear your mind of daily stresses. You are not alone in this. Talk to someone about your feelings and find a place of support, whether it be formal counseling or informal conversations with colleagues who understand what you're experiencing. Scheduling breaks during the workday, making time for humor, engaging in hobbies and exercising regularly, and focusing on nutrition and healthy living may also improve your symptoms. Lastly, it's important that you educate yourself on the signs and symptoms of compassion fatigue, as it's often misdiagnosed as job burnout. Recognized compassion fatigue expert Catherine Dobbs agrees with human medicine in distinguishing the difference between the two as this: burnout is stress that results from the work environment, while compassion fatigue is an internal and personal exhaustion that develops from relationships with patients and clients. However, compassion fatigue can lead to burnout and is completely normal, but entirely manageable. Remember, you are not alone. Ours is an emotional profession. Dealing with these emotions in a healthy way is crucial for our own and our patients' well-being. Thank you.